Hello, parents. I, Leena Raut, welcome you all on Gen X Parenting. September is World PCOS month, and on that occasion, I have with me Dr. Nilima Vaidya Bhamre. She is not only a leading gynecologist, but also a president of Association of Medical Consultants. She is an LLB from Nalanda Law College, Mumbai University, and founder of Mumbai Dhadkan, the aggregator of NGOs to channelize the help so as to reach out to the right audience. Let us talk to her about PCOS in teenage girls so that we parents can understand how to support and help our daughters deal with the PCOS issues in a right manner. Hello, ma'am. Welcome to Gen X Parenting.
Hi, how are you?
I'm
All good?
Yes, absolutely. So, ma'am, on the occasion of this World PCOS month, we are here with you. And my first question is, what is PCOS in simple language? How is it different than PCOD? And what is happening that so many teenage girls are having the PCOS issues?
PCOS or PCOD is polycystic ovarian disease or syndrome, which is the same thing. But whenever we say PCO, it means a polycystic ovary. We are not talking about the disease or we're not talking about the syndrome. We are talking about the sonographic appearance of the ovaries, which are polycystic, right? When we talk about a disease or syndrome, it is a collection of symptoms and signs along with the sonography, along with the blood test, along with the hormonal profile, along with the clinical presentation, the entire spectrum, which makes it a syndrome or a disease. And we are seeing it more and more in our younger generation because we are now more aware of what this is. We are now more aware of what the long-term implications of this disease is. It is not that polycystic ovaries were never present, but whatever the mind doesn't know, the eye doesn't see. So as technology improved, the science progressed, these things came up, the sonography machines were better, they were able to pick up these polycystic ovaries better. And then we started correlating it with the hormones. And now, yes, it's an established entity, which we definitely need to take care of.
Ma'am, when I read about PCOS or PCOD, the symptoms were like weight gain, acne, irregular menstruations. And if you see, these are the common issues during the adolescence of a girl child. So when the mothers should get alarmed and check for PCOS or PCOD.
You very rightly said, all these are symptoms and signs which we are seeing during the adolescence, pubescence and prepubescence period when the menstruation is just about starting. First 2 or 3 years, I would really not worry so much unless my daughter is having a lot of irregular bleeding, a lot of heavy menstrual bleeding, or she's developing too many acne or too many signs of hirsutism, all right, a lot of hair growth and all that. I would really not worry so much. Let that period of adolescence just pass through. Give psychological support to my daughter. See to it that she's not putting on too much of weight because that is one of the mainstays, of a lot of problems that we are seeing now. So, as a mother, I would take care that I am doing a good exercise routine for my daughter. I'm putting her up on a good diet. And that is the time, I try and tell my daughter, see, you're developing this, you're becoming a woman, and you want to grow up into a beautiful, healthy woman. Then these are the things which you're going to do. And if at all the lifestyle changes are incorporated at that particular time, maybe we will see a very less number of PCO cases than we are seeing now. So at that particular time, we do not want to really differentiate between a PCO and adolescence changes that we are seeing. But few years down the line, if these things persist, and like I said, if there's excessive bleeding, which is something which is really bothering you, too many fluctuations in the menstrual cycles and too much of hair growth and all that, yes, definitely you should be going into your doctor and trying to find a differential diagnosis also, because everything is not PCO, right? There may be some other entity which are mimicking PCOs. So we have to take care of that too.
So, ma'am, as I said in the previous question, that the symptoms are very common: acne, weight gain, irregular periods. So, we see this tendency in the society quite a lot that क्या जरूरत है, ये तो मेरे टाइम पे भी होता था, क्या मुझे ये सब नहीं हुआ? So, considering all these things, why do you think the treatment or giving the therapy for PCOS or PCOD it's so important that every parent should opt for it if they observe or if the daughter gets diagnosed with this particular disorder?
I think there's a little amount of misunderstanding here. Okay, PCOS or PCOD is not only limited to the adolescent age group. It can come a little bit later. It can come much, much later also, when you are well past 30, 35 also. So adolescence, yes, definitely it is a time where we see a lot of PCOD. And like I said, I believe in prevention. PCOD is a sort of a warning signal to a much larger problem later in life. We consider it to be a part of a metabolic syndrome. A metabolic syndrome is something where there's a risk later on to your heart. All right. So in PCOD, we see all those kind of symptoms because of increased androgens. The basic etiology of PCOD, though we don't know, the long-term effects we know, it may cause a lot of infertility. It can cause hirsutism, the excess androgens, the baseline inflammation, which is there. So it has a lot of effect on your heart. It has a lot of effect on your lipid profile. Your lipid profile is haywire. So there are a lot of other implications also. It is also a high estrogen kind of a problem because of which there's endometrial proliferation, and later on you can develop an endometrial cancer. You can develop type 2 diabetes. It is also an early precursor which warning you for depression and anxiety and heart problems and all. So if at all the PCOD is diagnosed early and the treatment is instituted early, we can definitely treat this and see to it that the long-term complications are prevented or at least minimized. Type 2 diabetes is what we are most worried about in PCOD, because in PCOD, the insulin resistance is very high. So though your body does release insulin, it does not work because the tissues are not responding to it. So all your target therapy is generally to improve the insulin consumption by the body, or the activity of the insulin on the body cells, because we know that insulin is the one which regulates your blood sugars. And if that is regulated well, then everything else comes under control. Exactly, that is why we want PCOD to be diagnosed early and treated early.
As we're talking about PCOS in teenagers, one more question that comes up to my mind is that ensuring treatment adherence with teenage patients, because it's an age wherein the seriousness of this treatment sometimes is not understood by the patient.
A very tough question indeed. It is not just the adherence to therapy for PCOS. In adolescence, adherence to anything is difficult. All right. So PCOS का treatment तो बात की बात है. It is very, very tough. So here the mother and daughter, or the parent and the daughter relationship comes into play. And the more you talk to your teenage daughters and explain to them, about the long-term effects of PCO, if you try and explain that to them very scientifically, I think that the girls will definitely understand. The more you talk to them about their physical appearance, at that particular phase, the physical appearance is more important to them than the long-term complications of the PCO. So you have to tell them about these acne marks, you have to tell them about the hair growth, and how they can prevent it by adhering to therapy very well. And वो थोड़ा सा डर अगर आपने डाल दिया, तो I think the teenagers will definitely adhere to it. But if you're going to talk to them about gestational diabetes तुमको हो जाएगा, and long term you get hypertension and all, I don't think they're going to listen to you too much. But yes, beauty matters at that time. So you talk to them about that, and they will stick to your therapy.
So, ma'am, as I can see that a role of a mother is extremely important over here. And hence, this is a very important question as Gen X parenting deal with the parenting challenges. So what are those extra miles that a mother has to undergo to help or to support her daughter to deal with PCOS?
The most important thing a parent can do is to be a role model. It is very easy, to point fingers. I always tell this, my favorite dialogue, and please listen to it. When you point fingers, there are 3 fingers pointing back at you. When you're trying to tell anything to your teenage daughter, you do this, there are 3 fingers telling you that, Mama, you also do this. So participate in all the activities. When you're telling her to go on a diet, see to that you're not buying anything in the house, which is very easily accessible to this teenage person. So she can land up binging and all. So your own habits have to change. You should participate in the exercise ritual also. You should show her that weight loss is possible. Never body shame the teenager, all right? Never ever do that. But definitely you have to tell them about the long-term side effects of being obese or being overweight. And whatever you tell them, be a friend to your daughter. That is the first thing. What you could also tell them is, suppose in case you, because many times you've seen that the PCOD is a genetic problem. It comes from mother to daughter. So the mother herself also may be having a lot of acne marks and all, so she can point out to her daughter saying that, see, this is the kind of problem I face. So you don't want to face that, right? So you have to take care. I did not take care at that time, but now if you take care, you will not land up having these problems. And when you are into therapy, do it together. Go with her to the doctor's appointment, sit with the doctor. Don't criticize her in front of the doctor. But when you go home, yes, then you say, beta, ye maine kaha tha aapko. But doctor ke samne mat kaho. The teenagers don't like it. So as a role model, yes, you are going to do the weight loss program yourself. You are going to be eating as well as you want the daughter to eat. So no binging for you either. All right. So both of you follow the same lifestyles and exercise programs.
Thank you, ma'am, for this insightful discussion. Teenage is a very delicate phase, and PCOS adds on to the challenges. This vlog is an attempt to support all those moms whose daughters are having PCOS. I hope it was helpful to you. For more such informative videos, do check out Gen X Parenting. And yes, for your support, I am also sharing few more vlogs which are relevant to teenage parenting, about how to deal with body shaming, how to ensure internet safety for your children. So do check them out too. Thank you so much. Thank you, ma'am.